This presentation provides an overview of skin cancer as a public health issue in Australia and will explore determinants of skin cancer using the Red Lotus model of health and wellbeing as a guide. So what is skin cancer? According to the Skin Cancer Foundation, skin cancer is the out-of-control growth of abnormal cells in the epidermis, the outermost skin layer, caused by unrepaired DNA damage that triggers mutations. These mutations lead the skin cells to multiply rapidly and form malignant tumours. The main types of skin cancer are basal cell carcinoma, squamous cell carcinoma, melanoma, and Merkel cell carcinoma. Epidemiological studies have shown a strong relationship between increased diagnosis of skin cancer and exposure to ultraviolet radiation. Despite the multitude of education and preventative programs available, Australia still has the world's highest incident rate of skin cancer. Studies show that in 2016, 1,960 Australians died from skin cancer, with approximately 2 in 3 people being diagnosed before the age of 70, amounting to nearly 80% of newly diagnosed cancers. In regards to improvement of health and health promotion, skin cancer represents a serious public health issue.
Looking through the lens of the Red Lotus health promotion model, a variety of interweaving determinants have been found to have an effect on the development of skin cancer.
Individual determinants of skin cancer include the biological aspects of age, gender, ethnicity, and genetics, all of which will be discussed in greater detail during this presentation. One socio-economic determinant includes education. Studies have found education on the dangers of UVR often leads to changes in attitude towards sun protection and subsequently encourages sun protective behaviours, which then, in turn, lowers one's risk of skin cancer. Individual beliefs and values regarding the attractiveness of a tan prevent people from avoiding UVR and using sun protection, with 75% of adolescents desiring some sort of tan. However, time trend data shows that preference for a suntan decreased in adults from 25% in 1990 to 15% in 2000. Physical behaviours are also highly linked to the prevalence of skin cancers, including solarium use, sunbathing, and outdoor exercise.
Environmental determinants of skin cancer include atmospheric changes such as climate change and our thinning ozone layer. It is estimated that a 10% decrease in ozone levels will result in an additional 300,000 non-melanoma and 4,500 melanoma skin cancer cases. A second environmental determinant is the shade in our built environment from trees, canopies, or mesh shades. Research has found that the majority of man-made shade structures do not provide sufficient protection from the sun's harmful UVR. We will now discuss in greater detail the determinants which have been researched extensively and were found to be the major determinant of skin cancer: genetics, sex, age, and physical behaviours.
Skin colour is the primary inherited trait which influences the risk of developing skin cancer. Skin cancer is more common in those with light and fair skin, and therefore contributes to an attitude of "I'm not likely to get it, so I won't bother checking," which leads to late diagnoses and worse prognosis for those with darker skin. One study found an average 65% 5-year melanoma survival rate in people with dark skin compared to 91% in those with light and fair skin. Melanoma diagnoses are more common in Hispanic people and people of colour compared to non-Hispanic and Caucasian patients. 50% of basal cell carcinomas are brown in colour, which makes the skin cancer easier to miss in people with dark and pigmented skin. Some other genetic traits that increase the risk of skin cancer are phenotypes such as red or blonde hair, blue eyes, navy, and freckles.
Linking closely with the determinant of genetics, the biological characteristic of sex also influences an individual's risk of developing skin cancer. Epidemiology has consistently found that rates of skin cancer are higher in males than in females, with 1 in 14 males being at risk of diagnosis, while females have 1 in 24 risk. In 2014 Australia, males accounted for 63% of all non-melanoma skin cancer diagnoses. In the same year, there were 30% more new male diagnoses of melanoma than there were in females. Males are worse off than women in many aspects of the disease, including prognosis of skin cancer in all age groups, second malignancies in childhood, and mortality in adulthood, with women being 6% more likely to survive for 5 years after the initial diagnosis.
A third biological determinant of skin cancer is age. An abundance of research on the topic concludes that the older population have a higher risk of developing skin cancer due to their higher accumulated hours of sun exposure. Only 9.2% of people diagnosed with melanoma are under the age of 40 years. 11.2% are aged 40 to 49, 18.4% are aged 50 to 59, 24.4% are aged 60 to 69, 20.4% are aged 70 to 79, and 16.3% are aged 80 or older. In 2010, 83% of all non-melanoma skin cancer treatments were administered to patients aged 55 and above.
While the biological determinants of genetics, age, and sex are impossible to control, research demonstrates that the sun protection, an action entirely within our control, acts as a preventative factor against skin cancer. Protective clothing and avoiding the sun during peak UVR times both greatly decrease a person's risk of developing skin cancer later in life.
The inequality of gender-related skin cancer rates can be explained by the determinant of employment. Based on 2011 Australian census data, it was found that male-dominated occupations such as farmers, drivers, and miners, as well as men holding a trade certificate and living in regional areas, have the highest risk of skin cancer due to frequent exposure to UVR. In 2001, there were 192 cases of males diagnosed with occupation-related melanoma, compared to only 15 cases in females. Physical behaviours such as tanning, solarium use, physical exercise, and employment are major contributors to the risk of skin cancer due to their high exposure to UV. Exposure to UV radiation causes 95% of melanomas. With 1 in 8 adults and 1 in 5 teenagers being burnt on an average weekend, it's no wonder skin cancer rates are as high as 2 in 3 people by the age of 70. Solarium use emits UVR, which is the primary cause of skin cancer. As of January 2016, commercial solariums were banned in all states in Australia due to the high risk they possess. While there is very little positive news being yielded from time trend epidemiology, data does show several improvements. Research tells us that if melanoma is identified at an early stage, simple treatment can result in a complete cure. Recent advancements in surgical technology and additional treatments, such as radiation therapy and chemotherapy, has also improved the life expectancy of those in the advanced stages of skin cancer. Additionally, Cancer Council Victoria's Slip Slop Slap campaign, launched in 1981, has contributed to the dramatic shift in sun protective behaviours and attitudes, leading to a 46% decrease of melanoma in Australians aged 15 to 29. In summary, Australia has the world's highest rate of skin cancer. This can be attributed to a variety of determinants, the most prominent being biological and behavioural. Underlying determinants include those which are cognitive, socio-economic, built, and natural. Biological and occupational social injustices cannot be removed, only protected against through early sun protective behaviours.